So basically, diabetes is a condition in which the pancreas, which is an organ that we humans have inside of our abdomen, is not producing enough insulin. Insulin is a hormone that goes inside of your bloodstream, and when you eat carbohydrates and eventually they are converted into sugar in your bloodstream, insulin will help this sugar to get inside of the cells where it's needed. The sugar provides energy to the cells. If you don't have enough insulin, the sugar will remain in your bloodstream and it will cause further damage. There are different types of diabetes. However, we will concentrate mainly in two different types: diabetes type 1 and diabetes type 2. Diabetes type 1 is a condition in which your pancreas stops producing insulin or is producing only a small amount of insulin. Normally, patients are born with this defect in the pancreas, and for that reason, diabetes type 1 is diagnosed when the patient is still young. Many times they are kids or teenagers when they are diagnosed with this problem. Diabetes type 2 is a little bit different. In this condition, your pancreas is still producing insulin. However, the patient many times has become obese, so the amount of insulin produced by the pancreas is not enough, and there is a condition which is called insulin resistance. That means that even if your pancreas is producing insulin, it's not enough to put all the sugar inside of the cells, and many of those molecules of sugar, they remain in your bloodstream. Eventually, your pancreas is damaged because it's overworking, and eventually it becomes non-functional. So your pancreas also stops producing insulin. Patients with diabetes type 1, they normally need to be treated with insulin from the very beginning because their pancreas is not producing insulin at all. On the other hand, patients with diabetes type 2, which are normally diagnosed later in age, when they are normally in their 30s, 40s, or even 50s, they can start taking oral medication for diabetes. These pills, what they do is that they kind of squeeze your pancreas to produce more insulin, or they make the cells more receptive to the effect of the small amount of insulin still produced by your pancreas. Many times, however, patients with diabetes type 2 eventually might need insulin, or if the diabetes type 2 is too advanced and severe at the time when it's diagnosed, they might need insulin from the very beginning. On top of that, many of the oral medications are not good for everyone. What is good for one patient might not be good for another one. For example, if a patient has some kind of kidney damage, there are certain pills for diabetes that you cannot use. You will produce more damage instead of benefit. Based on that, it's absolutely necessary for any patient having diabetes to see a physician to provide good guidance into their treatment. On top of medications, there are other things that patients with diabetes need to do. One of them is exercise. If you remain active, you will lose weight, and that is going to help with the management of your diabetes. The more obese you are, the more difficult it's going to be to provide control into your disease. Second, diet. So you need to implement or start a healthy diet that is going to help with the management of your diabetes. Third, you need to visit your doctor in a regular fashion, because many times we need to implement changes into your medications, and you also need to monitor your blood sugar levels at home and with blood workup. And fourth is medications. So basically the four big pillars for the management of diabetes are diet, exercise, frequent monitoring, and medications. If you believe that you might have diabetes and you are not receiving any type of treatment, or if you know that you have diabetes but you are not seeing any doctor or having any guidance, call us. We are here to help you. We can start you right away on the right treatment and give you all the tools that you need to take control of your disease.